Welcome, ladies and gentlemen, to this week's episode of the BioSlife franchise product training call. My name is Dr. Peter Verdegam. I'm the Chief Science Officer at Unicity International. Thank you for calling in this week. We have an important call coming up, and the topic of this week's call is Osteo-Essentials. And that's actually a product I haven't been talking too much about in my lecture series, Osteo-Essentials, simply because actually the truth is we have a number of other products that overlap with this product quite a bit. Osteo-Essentials is a combination product of different other products we have in Unicity product line. The name Osteo-Essentials basically says what it does. It has to do with bone, it has to do with joints, and it is an essential product, absolutely, because it contains ingredients that are known to promote the health of your joints and your bones. But as you also know from our previous calls, we have other products that do exactly the same thing. So why do we have Osteo-Essentials on one side and products like Bone Mate Plus, glucosamine AJF, and CMPlex on the other hand? Well, that's a very good question. It all has to do with basically, first of all, individual preference. Some people like to take those three products I just mentioned into one product. And basically, Osteo-Essentials has ingredients that overlap with those three products. Another reason may be that certain people have a different biochemical makeup. And some people they respond better to certain type of ingredients than others, which makes Osteo-Essentials a better product for them. That is just basically based on individual preference and biological makeup. What is Osteo-Essentials? Well, Osteo-Essentials basically contains 7 active ingredients, but 3 of those are the most important ones. Let me explain those 3 ones. First, we have a good calcium source in Osteo-Essentials, and that's a no-brainer. Calcium, of course, is very important for your bone health and to prevent bone loss during the period of your life, such as, osteoporosis is, of course, a very common disease, particularly for women, but also for men who tend to lose bone later in life. You want to prevent that. A good source of calcium that gives you calcium which is absorbable, which actually goes into your blood and not just pass through your body, is just the most important form of calcium that you can give. That's one key ingredient in Osteo-Essentials. The second one is glucosamine. And glucosamine is a very well known because, as I already mentioned, the product glucosamine AJF, advanced formula, which is our other glucosamine product. Here, glucosamine is embedded in the Osteo-Essentials. Glucosamine is, of course, a building block of cartilage. Cartilage is the cushioning tissue between 2 joints that can be reduced in thickness or in strength over time, particularly when you develop a disease called osteoarthritis. And this can be, very painful, causing you a lot of discomfort and interferes with a lot of your daily activities. And a very good approach to dealing with this loss of cartilage structure in your joints is to add the building block. Make sure your body has adequate supply of building block to make sure it can rebuild cartilage over time. And that's why glucosamine is in Osteo-Essentials. The third ingredient in Osteo-Essentials is Boswellia serrata. And Boswellia, you may not have heard of this, but Boswellia really is a anti-inflammatory natural herbal extract. Now, this compares to CMPlex because CMPlex also is an anti-inflammatory ingredient, but just a completely different type of anti-inflammatory. CMPlex is a fatty acid, reacts in some way with the inflammatory process in your body. Boswellia serrata is a herbal extract, a completely different kind of material, but also has ingredients in it that are known and have clinical proof behind it, showing that it reduces swelling, inflammation, painful joints. And that combination with glucosamine is just a very good combination because on the one hand, you provide your body the building block. On the other hand, you provide your body the way to deal with inflammation and pain and swelling. Now, why does CMPlex work better for certain people and Boswellia for other people? We don't know. That all has to do with, how you're made up, how your body reacts to the individual ingredients. But Osteo-Essentials is in our product line because it has a wide following group. We sell it in many different parts of the world. We sell it in not only in the United States, but also in the Philippines, in Venezuela, Japan, Korea, just to name a couple of countries where we sell the product. And that means we have a large group of people, that say, I know we have CMPlex and glucosamine AGF, but I stick to Osteo-Essentials because I know it's doing for me what I wanted to do in the product. And, of course, that's a great decision. Now, today on the call, I have a very special guest with me, and that guest is Dr. Lou Brady. Dr. Lou Brady is a friend of mine. I met him many years ago I actually spent the night at his home in Orlando, Florida. That's where he lives. And he is a specialist on this product because of his background and because he used it himself for a long time. Dr. Brady, welcome to this call.
Thank you very much, Peter.
Thank you very much for joining me. I'm looking forward to chatting with you about Osteo-Essentials and about your personal experience with this product. But before we go on, maybe you can tell the audience what your specialty is, what your background is, what your history is, so to say.
I'm a retired orthopedic surgeon. I'm a graduate of the University of Florida with a BS degree, the University School of Medicine, Emory University School of Medicine with an MD degree, and I am a board-certified orthopedic surgeon with the American Academy of Orthopedic Surgeons. I have been practicing in Orlando since 1954 and retired 4 years ago. I am a firm believer in all of these products, and I became interested in this, Peter, if you'd like to have a little history of how I became involved with it. Jim Moyles, who everyone who on this call knows, sent me an article with a sample of the CM Plex. This must have been 8 or 9 years ago, and in this article it was a study of over 600 patients. This was done in Southern California, 200 of which had placebos, 200 having only the acetyl before it was compounded as CM Plex as we know it today, and another group that took both CM Plex and the glucosamine together. As in all studies, the group that received the placebo had a 15 or 20% improvement, but those that received the acetyl had more than an 80% improvement. This was in a 6 weeks period of time, but interestingly enough, there was a group that took both the CM Plex and the glucosamine together had almost a 95% improvement. I have suffered with osteoarthritis all of my adult life and have taken practically every anti-inflammatory known, beginning with aspirin many years ago, so that my ears constantly ring. And I was eager to find something instead of the non-steroidal anti-inflammatory drugs that I was on, and I began the combination of these two with a dramatic result, as I have reported in past conversations with you. I have religiously taken both of those products ever since that time, and have never taken an NSAID since. Needless to say, my response to this prompted me to begin using this with my own patients, and I began to have exactly the same response from my patients, and the studies that have been on this confirm the fact that it does work. And interestingly enough, as I mentioned to you earlier, Peter, in Europe, glucosamine is the primary starting product for patients with early osteoarthritis.
That is very interesting, Lou, because as you know, I'm from Europe, and in Europe, I know quite a number of examples of things that we consider dietary supplements are actually registered as medication over there, which complicates, by the way, our doing of business over there for a legal perspective. But it means that, you know, there is quite a body of substantial evidence out there that glucosamine is, in fact, a very effective product if you have pain due to osteoarthritis. And that's a great example that in some countries, medicine looks differently at certain ingredients as we tend to do here in the United States. Now, just to clarify things, you said it in the beginning that you were interested in the research of glucosamine and CM Plex together. So you are currently taking both ingredients together, but glucosamine in the form of Osteo-Essentials. Am I correct? So you're taking Osteo-Essentials together with CM Plex?
That is correct. I take the Osteo-Essentials 1,500 milligrams a day, which is the recommended dosage. That is the same dosage that I've recommended to my patients who have taken the product.
Right. Great. That clarifies it. Now, that's actually an interesting combination because usually I know people that take CM Plex and glucosamine AGF as a combination product, and by doing so, you get glucosamine and you get the CM Plex. Now, you've chosen to take Osteo-Essentials as a source of glucosamine, and that means you also take a little bit of Boswellia in this product, and Boswellia has its own anti-inflammatory effect on the joints, and that gives you a combination of citral and Boswellia. That's an interesting combination, and apparently it has worked very well for you. Now, you mentioned that you gave it to your patients. I mean, you suggest it to your patients when they have specific forms of arthritis and osteoarthritis. Can you explain what type of patient you think is a suitable candidate for taking the CM Plex Osteo-Essentials combination?
The patients who responded the best to the Osteo-Essentials were patients with arthritis in the knee. I'm not sure why it was not as effective in the hip as it was in the knee, but many patients reported to me that they could take the Osteo-Essentials, and after about 10 days to 3 weeks, they would begin to have a significant improvement in their pain pattern. And my wife, Marilyn, has taken it. She's a tennis player, and occasionally her knees will begin to bother her, and she has taken the Osteo-Essentials and has had a significant improvement, and she has never been on an NSAID.
When you talk to your patients, what is your typical response of your patients? Of course, I know you're retired now, but since the last couple of years when you were still in practice, are your patients receptive to this kind of treatment as opposed to pharmaceutical intervention?
Oh, absolutely. In fact, sort of an anecdotal story, the way I first became aware of glucosamine, before I ever heard of Osteo-Essentials, patients were coming to me and telling me that they were taking this product they were buying at the health food store called glucosamine, and it was helping their arthritis. And I just poo-pooed it, as most doctors do, things that people come from health food stores, until I went to a meeting of the Academy of Orthopedic Surgeons about 8 years ago in California, and there was some 30 papers on the effectiveness of glucosamine at that particular meeting. And it was immediately after that I began offering that to my patients as an alternative to the NSAIDs. And as you know, NSAIDs have a lot of side effects. In fact, one or two of them have been taken off the market because they have such bad side effects.
What are some of the side effects you see with NSAIDs?
Well, gastroenteritis is the worst one, but one of them actually caused an increase in the number of heart attacks that patients had, and that was the Vioxx. Everybody knows about Vioxx being taken off the market because of that side effect.
Yeah, absolutely. That was a very big story, and still is, of course, because of all the lawsuits surrounding the Vioxx withdrawal from the market. It's interesting to me that you say, well, I poo-pooed it initially and discovered myself it was actually a very effective product. So it's a nice confession, which I have to face almost every day when I speak with healthcare professionals about some of our products. And, what all it takes basically is the most powerful thing is your personal experience of the effectiveness, and you have experienced the effect in your own joints, right?
Absolutely. I would not stop taking either one of the products because my arthritis was so bad before I started taking this. I was actually doing surgery at that time and was taking 2 NSAIDs at the same time trying to relieve it. And it completely relieved my pain, and I was able to stand up early in the morning. I got up before I could hardly walk. So the 2 products together for me, Osteo-Essentials and CM Plex, are a godsend.
Now, Dr. Brady, when somebody is currently using NSAIDs, as many people are, of course, for their arthritic pain, how do you approach that situation? What is your recommendation?
Well, I just offer them this as an alternative because practically all patients who take NSAIDs for any significant period of time will sooner or later begin to have the side effects of gastroenteritis. And it's very easy to talk them into taking something else other than that which they're getting sick on. And I just simply offer it to them and tell them this is an alternative. It's cost-effective, very inexpensive. It's been clinically proven in many studies. It's used significantly all over Europe. And why don't you try it?
Dr. Brady, I think that's the greatest advice of all. Thank you very much for your kind words and you sharing with us your professional expertise and your personal history about this product. It's really I'm very excited to hear these stories from you because I know that as you have experienced it yourself, many people have done so, the same thing. And I mean, when you talk about pain, when you talk about disability due to osteoarthritis or other arthritic pain, you know what a pain relief and how that can change your life. And I'm sure you experienced that yourself. Now you're retired and living in Orlando. It's a nice place to be retired, for sure.
Yes, I've been retired, but my wife, Marilyn, and I stay quite busy. We're franchise owners with Unicity, and have been active for over 8 years in that plan. And we promote these products, have home groups here frequently, and have even hosted the company here recently in Orlando.
Well, thank you, Dr. Brady, and give my regards to your wife, Marilyn, for your leadership over the years, and thank you very much for participating in this call. Ladies and gentlemen, thank you very much for calling in this week. I hope you learned something about Osteo-Essentials. I for sure did, and I know it's a great product for a lot of people out there in the world, relieving them from arthritic pain. Thank you very much for calling in. I hope you'll do exactly the same thing next week. Thank you, and bye-bye.